Assalamualaikum warahmatullahi wabarakatuh. Today we are going to present on heart attack analysis and prediction. These are the table of content which consists of introduction, methodology, data storytelling, conclusion and system dashboard. First part, introduction.
Hi, Assalamualaikum. My name is Tasnim binti Mahamud. So, what is heart disease? Heart disease includes a wide range of cardiovascular problems. Heart disease is a collection of disease and conditions that cause cardiovascular problems. There are some types of heart disease and the causes. First is the arrhythmia of an abnormal heart rhythm include diabetes, high blood pressure, excessive alcohol or caffeine, and others. Second is the atherosclerosis, which is the result from plaque build-up in the arteries. Third is the cardiomyopathy, where it leads to the weakened heart. Next is congenital heart defects, when it occurs to a baby in the womb. Next is heart structure can also change by age. Next, the coronary artery disease result from the plaque build-up in the arteries. And lastly, the heart infections. Uncontrolled infections is the body caused by bacteria, viruses, and parasites. The infections can harm heart if not treated properly. Next is the risk factors and the treatment for the heart disease. Risk factor: high blood pressure, high cholesterol, smoking, obesity, physical inactivity are the risk factors, while family history, ethnicity, sex, and age are the uncontrolled risk factors. Besides, for the treatment that available for heart disease are the lifestyle changes by switch the unhealthy diet to diet provided for heart disease patients, getting regular exercise, and stop smoking. Other than that, medication may help to slow down or stop the risk for complication occur. Then, the surgery or invasive procedures are provided when the arteries are blocked almost completely by the plaque build-up problem. Next is problem statement. There are half of Americans, 47%, have at least one of three risk factors. That is why the treatment largely depends on the type of heart disease. Next is the objective are to study the risk factors for heart disease and to identify the treatment available for heart disease. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nashaira binti Sabudin. I will present on the aim and the mission of this project. The aim of this project is to visualize data about heart attack prediction in corresponding to some factors that contribute to these diseases. Next, our mission. First, gather information and dataset from Kaggle. Second, examine the dataset. Third, list out attribute for data presentation. And lastly, perform data presentation using Power BI.
My name is Nurul Akila binti Abdullah and I will explain about user requirement for functional and non-functional. For functional, first, view the data visualization of heart disease. Second, filter and clean data. Third, analysis the graph. Fourth, identify the cause of heart attack. For non-functional, first, data of heart attack analysis and prediction should be visualized by graph. Second, the data should be visualized using Power BI or Tableau. Third, the visualization should be simple and out of complexity.
Second part, methodology.
Assalamualaikum. I am Nur Najih Hamdi Hamdan. I will present the methodology. Firstly, we go to data collection. This dataset is about heart attack analysis and prediction. This dataset contains 14 attributes and 303 instances. We only use 8 attributes, which are sex, age, chest pain type, resting blood pressure, cholesterol, fasting blood sugar, resting electrocardiography, and output. This is data description for this dataset. Age, sex, whether male or female, chest pain type, 1 for typical angina, 2 for atypical angina, 3 for non-anginal pain, and 4 for asymptomatic. Resting blood pressure, cholesterol, fasting blood sugar, 1 for true if more than 120 mg per dl and otherwise. Resting electrocardiography, 0 is normal, 1 is having ST with abnormality, and 2 is showing probable or definite left ventricular hypertrophy. And lastly, output is target variable, 1 for more chance and otherwise. This is data dictionary. The type of age is numeric and size 2. Sex is binary, size 1, and so on. Data preparation is the process of gathering, combining, structuring, and organizing data so it can be used in data visualization application. In this dataset, we remove maximum heart rate achieved, exercise-induced angina, previous peak, slope, number of major vessels, and trial rate. Firstly, we open Power BI and select Get Data and connect data hard to it. Next, when the data started to display, we clean the data to appropriate need for the project and the data is ready. Thank you.
Next, I will present on data analysis. Data analysis is a process of systematically applying statistical and logical technique to describe and illustrate content and recaps and also evaluate the data. The precise and suitable analysis of research finding is an essential component of ensuring data integrity. The data that has been chosen to analyze are: first, graph about chest pain type of the heart attack patient by sex; second, number of patient and heart attack prediction by resting blood pressure; third, number of heart attack patient by age and sex; fourth, number of heart attack prediction of patient by cholesterol level and age; fifth, number of heart attack prediction of patient by fasting blood sugar; and lastly, number of heart attack prediction of patient by resting electrocardiography.
Next, data storytelling.
Next, for storytelling part, these figures show the chest pain type that occur to the patient by sex. From the figure, it shows chest pain type 1, which is typical angina, occurred the most to male, which is 104 patients, while only 39 patients that are female. Chest pain type 2 is a typical angina which occurred to 32 male patients and 18 female patients. Chest pain type 3 is non-anginal pain which occurred to 52 male patients and 35 female patients. Chest pain type 4 is asymptomatic pain which occurred to 19 male patients while only 4 female patients. From this figure, we could see that male patients are the ones who are large in number for every chest pain types. Chest pain is one of the most contributed factors that lead to heart attack diseases, as chest is where the heart is located.
The figure shows the number of heart attack prediction of patient by cholesterol level and age. From the figure, it shows patient in middle-aged adult which is 40 to 59 years old consider most cholesterol level indicates 48,000 mg per deciliter, while adult which is 20 to 39 years old has the lowest cholesterol level which is 3,000 mg per deciliter. The number of prediction of having heart attack for patient in middle-aged adult is 150 patient, which is the highest compared to adult and senior adult, which is indicate 12 and 38 patient respectively. In conclusion, people at the age of 40 to 59 years old has the most potential of having heart attack. Risk to have high cholesterol level may increase as you get older. Men in their 45 and older and women in their 55 and older have a higher risk of having high cholesterol level and heart diseases.
It shows that the number of heart attack prediction of patient and fasting blood sugar by age. For the fasting blood sugar, we use value 1 and 0 for true and false respectively, which means for every level of fasting blood sugar greater than 120 milligram, we set it as true and the value is 1. And for every level of fasting blood sugar is below than 120 milligram, we set it as false and the value is 0. So, the number at the graph shows that the sum of people who have high fasting blood sugar and the less fasting blood sugar. For example, at the age of 40 until 59 years old, there are about 30 people who have high fasting blood sugar and about 15 people at the age of over 60 years old have high fasting blood sugar. So, for the prediction of heart attacks, among people at the age of 40 until 59 years old is the highest compared to the another age group of people. At the age of over 60 years old, people also get chances to have heart attack.
The last part is conclusion.
In conclusion, this study visualized the heart attack analysis and prediction. This study shows, first, male tend to have chest pain than female. Second, patient in middle-aged adult has most potential of having heart attack. And lastly, men aged 40 to 59 and women aged 40 to 59 have a higher risk of high cholesterol and heart diseases.